and I am a 13-year metastatic breast cancer survivor. Yeah, I've been living with metastatic breast cancer for 13 years. I'm also a 25-year Air Force veteran. My mom died of metastatic breast cancer in 2004, and 5 years later, in 2009, I received the diagnosis. I did participate in a clinical trial in 2018. Actually, it started in 2018, and I'm glad I did. The clinical trial worked for me for 3.5 years, and then subsequently I had to get off of it because I caught COVID pneumonia. And one of the side effects of the clinical trial was ILD, lung disease. So my doctor elected to take me off and take care of my lungs from COVID pneumonia. But I just think that, Black women want to participate in clinical trials. Okay, let me say that again. Black women want to participate in clinical trials. It's just that we're not asked. I want anyone looking at this, medical professionals, to say, hey, let me ask my patient, does she want to participate in clinical trials? Or let me explain to my patient what clinical trials are. So in the future, if it comes down to a patient, having to go on a clinical trial, the patient will be like, oh, okay, my doctor did explain clinical trials to me. Statistically, 4 to 5% of Black women participate in clinical trials. And like I said earlier, it's not because we don't want to, it's because we're not asked. So what I see for the future for clinical trials, I see everyone being asked, and I see it as a standard of care for everyone. The clinical trial that I went on was not a last resort, so it's not always a last resort. But there are so many clinical trials besides treatment trials that you can go on, So I encourage anyone that has been diagnosed with metastatic breast cancer or breast cancer, period, to say, hey, what about this clinical trial and what about that clinical trial? Can you explain to me, And there are lots of reliable sources that you can go to on the internet that will explain clinical trials to you. I see the future as bright. I see the future as Black women being included in clinical trials, because we need to know why Black women get breast cancer so aggressively, but also why Black women are dying at a faster rate. We are worthy. We are worthy to be asked about clinical trials. The challenges in the future, I don't see a challenge. I see it as we're all coming together and say, what can we do to make Black women feel inclusive when it comes to clinical trials? When I walk in my hospital, there is a big billboard that says clinical trials and then explains what a clinical trial is. When I walk into my doctor's office, it says clinical trials, and it actually has my doctor's picture on it, asks about the clinical trials. And then when I'm in a waiting room on the TV, it's explaining what a clinical trial is. So if anyone is not really or a doctor has not asked them about clinical trials, that would joggle a patient's mind and go in the doctor's office and say, hey, Dr. such and such, what about this clinical trial, or what about that clinical trial? So please, it's important that we include all races, all cultures in clinical trial that we're asked. And it's so, so important to the Black community that we figure this thing out together. So I thank you. And yeah, if I ever have to participate in a clinical trial again, I would without hesitation, because clinical trials are literally saving my life. And those that participate in clinical trials, I thank you. I thank you. Because of you, I'm still here.